Welcome to Sakshi TV special NRI Ask Your Doctor show. I'm your host Shivani Raj. For today's show, we have Dr. Damodhar Nerella. He completed his MBBS in the year of 1996 and did his internship from Osmania General Hospital, Hyderabad. Again, in UK, he went to UK in the year 1996 and did his PLB exam and started working in UK. He later did his MD in internal medicine from Blue King University, New York City, from 2001 to 2004. He started practicing internal medicine in Greenville, South Carolina since 2004 and was the medical director for several nursing homes and assisted living facilities. So without any further delay, let us welcome Mr. Damodhar Garu onto our show. Doctor, hi Andy, how are you?
Thank you, Adi Shivani Garu. I'm very glad to be on the show.
సో ముందుగా మనం షోకి వెళ్లే ముందు కొద్దిగా మీరు వ్యూవర్స్ కి ఎక్స్ప్లెయిన్ చేయగలుగుతారా అసలు వాట్ ఎగ్జాక్ట్లీ ఇస్ ఇంటర్నల్ మెడిసిన్?
ఇంటర్నల్ మెడిసిన్ ఈజ్ సిమిలర్ టు ఎండి జనరల్ మెడిసిన్ అండి ఇండియాలో. సో వైడ్ వెరైటీ ఆఫ్ కేసెస్ చూస్తాము, లైక్ మెడికల్ స్పెషాలిటీ, ఎస్పెషల్లీ hypertension, diabetes. We admit patients from the emergency room. వాళ్ళు డిశ్చార్జ్ అయ్యే వరకు ఫాలోఅప్ చేస్తాము, డిశ్చార్జ్ చేస్తాము, మళ్ళీ అవుట్ పేషెంట్ కూడా క్లినిక్స్ లో చూస్తాం వాళ్ళని. సో వైడ్ వెరైటీ. వీ ఆల్సో డూ క్రిటికల్ కేర్ లో చూస్తాము, తర్వాత కార్డియాక్ కేర్ లో చూస్తాము. సో వైడ్ వెరైటీ. లైక్ మీరు చెప్పినట్టు నేను బికాస్ ఆఫ్ ఇంటర్నల్ మెడిసిన్ నేను నర్సింగ్ హోమ్లకి మెడికల్ డైరెక్టర్గా కొన్ని సంవత్సరాలు చేశాను. అలాగే అసిస్టెంట్ లివింగ్ ఫెసిలిటీస్ చేశాను. తర్వాత హాస్పిస్ అని కూడా ఇక్కడ చాలా అప్కమింగ్ బ్రాంచ్, పాలియేటివ్ కేర్ మెడిసిన్, దానికి కూడా డైరెక్టర్గా చేశాను. సో వైడ్ రేంజ్ ఆఫ్ ఫెసిలిటీస్ యూ కెన్ సూపర్వైజ్ అండ్ you have more like flexibility on that.
So basically internal medicine in a sense, it is not just you're not just specifically dealing with specific organs, like how if you talk about cardiology is only for heart, and if you talk about neuro, it's only for brain. So you basically have a grip on all, like the whole human body, if I'm not wrong.
Perfect, you nailed it. Correct. The specialist focuses mainly on cardiologist, heart, but మేము అన్ని ఆర్గన్స్ అన్ని స్పెషాలిటీస్ కి మేము రెఫర్ చేస్తాం. లైక్ ఇప్పుడు మీరు అన్నట్టుగా సంబడి హ్యాస్ ఏ హార్ట్ డిసీజ్ అండ్ వాళ్ళకి స్టెంట్ కావాలనుకోండి, మేము కార్డియాలజిస్ట్ కి రెఫర్ చేస్తాము. అలాగే పల్మనాలజిస్ట్, ఇప్పుడు బ్రాంకైటిస్, సిఓపిడి, వాళ్ళని రెస్పిరేటరీ పల్మనాలజిస్ట్ రెఫర్ చేస్తాము. బేసికలీ ఇప్పుడు ఎస్పెషల్లీ కోవిడ్ పీరియడ్ లో బేసికలీ వీఆర్ ద ప్రైమ్ సోల్జర్స్ ఫ్రమ్ ద ఎన్కౌంటర్ ఫ్రమ్ ఎమర్జెన్సీ రూమ్ నుంచి మళ్ళీ వాళ్ళు ఇంటికి వెళ్ళేదాకా మేమే చూసుకుంటాం అన్నట్టు.
కోవిడ్ టైంలో యు వేర్ ఎ బిగ్ హెల్ప్. యాక్చువల్లీ ఎస్, కోవిడ్ టైంలోనే చాలా మందికి అసలు యాక్చువల్లీ ఇంటర్నల్ మెడిసిన్ ఏంటి, దాని గురించి దాని వాల్యూ, ఇంపార్టెంట్ వాల్యూ ఏంటో తెలిసింది. లెట్స్ గెట్ ఇన్ టు యాక్చువల్లీ కోవిడ్ న్యూస్ కొద్దిగా. So COVID time, how was the whole situation? And even now, see, COVID is not gone completely. Let's be honest with that. It is still going on. There are still people who are suffering from COVID. So what is the current situation with COVID? What is your outtake on this?
A very important and very useful question, Adi. So COVID entirely, not only medical system, any system changes. COVID time was really, terrible for doctors. I personally went through a big situation, especially going to hospital, intiki raavadamu. It was like literally like a kind of very stressful situation. So for your question, COVID podandi, COVID is going to stay with us. Like flu ఉంది కదా ఇప్పుడు మనము. సో ఫ్లూ పోలేదు, ఉంటుంది. మనము ఎవ్రీ ఇయర్ ఫ్లూ ప్రివెన్షన్ కోసం ఫ్లూ షాట్ తీసుకుంటాము. సో ఇప్పుడు కోవిడ్ కూడా అలాగే తయారైంది, అది పోదు ఇంకా. వీ హ్యావ్ టు లివ్ విత్ ఇట్. సో బేసికలీ ఇక్కడ మోస్ట్ ఇంపార్టెంట్ థింగ్ ఏంటంటే, ఇప్పుడు అమెరికాలో కరెంట్ సిచ్యువేషన్ మళ్ళీ కేసులు 8 times ఎక్కువ అయినాయి లాస్ట్ 1 week లో. బట్ mainly it is affecting children less than 5 years and adults more than 70 years వాళ్ళకి ఎఫెక్ట్ అవుతుంది. సో ఇక్కడ సిడిసి ఇమీడియట్లీ దే రిలీజ్ ద బూస్టర్ డోస్ అండి. సో ఈ లాస్ట్ ఫ్యూ డేస్ నుండే బూస్టర్ చేయడం జరుగుతుంది. సో అందరూ యూటిలైజ్ చేసుకుంటున్నది. సో ఇండియాలో కూడా కొన్ని కేసులు పెరుగుతున్నట్టుగా నేను న్యూస్ లో చూశాను. బట్ ఇది ఉంటది ఇక వరల్డ్ వైడ్ ఉంటది. ఇది అంటే వైరస్ వీక్ అయిపోయింది కానీ ఇట్స్ చేంజింగ్ ఎవ్రీ డే, ఇట్స్ చేంజింగ్ ఇట్స్ మార్ఫాలజీ లైక్ వేరియంట్స్. సో ద కరెంట్ వేరియంట్ ఈజ్ యాక్చువల్లీ నాట్ దట్ సీరియస్. అగైన్ పీపుల్ మెయిన్లీ ఇమ్యూన్ సిస్టమ్ వీక్ ఉన్న వాళ్ళు, చిన్న పిల్లలు, తర్వాత అడల్ట్స్, ఎల్డర్లీ పీపుల్ లైక్ 70 years పైన వాళ్ళు జాగ్రత్తగా ఉండాల్సిన అవసరం ఉంది. ఎందుకంటే వాళ్ళకి రిస్క్ ఎక్కువ, మోర్టాలిటీ రిస్క్ ఎక్కువ అండి.
చాలా మంది ఎస్పెషలీ పీపుల్ విత్, లెట్స్ టాక్ అబౌట్ కోవిడ్ టైమ్ లో చాలా మందికి ఎవరికైతే ఆల్రెడీ లంగ్స్ ఇష్యూస్ ఉండేనో, రెస్పిరేటరీ ఇష్యూస్ ఉండేనో, అండ్ ఈవెన్ ద మోస్ట్ డేంజరస్, ఐ ఫీల్ వన్ ఆఫ్ ద మోస్ట్ డేంజరస్ థింగ్ దట్ కెన్ హ్యాపెన్ టు అ హ్యూమన్ బాడీ ఇస్ డయాబెటీస్. సో ఈవెన్ డయాబెటీస్ వాళ్ళు కూడా, even though normal healthy human being got affected, but people with these kind of diseases were affected more. Can you explain kodiga heads up ivagaltara asal why did this happen? Induku people with diabetes and some kind of lung problems are more easily prone compared to a normal healthy person?
Very good question. Diabetes is considered as one of the like it's equivalent to myocardial infarction లాగా కన్సిడర్ చేయాలి. సో హై రిస్క్ అన్నట్టు, వాళ్ళకు ఇన్ఫెక్షన్ రేట్ ఎక్కువ ఉంటుంది. సో అందుకని ద ససెప్టబిలిటీ ఎక్కువ ఉంటుంది. కైండ్ ఆఫ్ దే ఆర్ లిటిల్ ఇమ్యూన్ కాంప్రమైజ్డ్ అనలేం కానీ లైక్ అండర్ టువర్డ్స్ దట్ సైడ్. బట్ ద అదర్ థింగ్ ఈజ్ ద అదర్ రెస్పిరేటరీ ఇల్నెస్ ఉన్న వాళ్ళకి ఎక్కువ ప్రాబ్లం ఎందుకు ఉంటుంది అంటే, ఇప్పుడు లెట్స్ టేక్ లైక్ బ్రాంకియల్ ఆస్మా, సిఓపిడి, ససెప్టబిలిటీ ఎక్కువ ఉంటుంది వాళ్ళకి. లైక్ ఎనీ వైరల్ ఇన్ఫెక్షన్ కెన్ లీడ్ టు సెకండరీ ఇన్ఫెక్షన్ అండి. ఇప్పుడు వైరస్ ఇన్ఫెక్షన్ ఇప్పుడు చిన్న కోల్డ్ కాఫ్ తోటి స్టార్ట్ అయ్యి అది లో రెస్పిరేటరీ ట్రాక్ట్ పోయి eventually bacterial infection start happening. Bacterial infection start when it becomes more widespread, respiratory distress syndrome. They will end up going on ventilator. So వాళ్ళకి already lungs weak ఉన్నాయి కాబట్టి, so the virus can multiply quickly and the strength to fight the virus కొంచెం కష్టం వాళ్ళ సిచ్యువేషన్ లో. అందుకని వాళ్ళకి సెకండరీ ఇన్ఫెక్షన్స్ వస్తాయి. అట్లా అందుకని వాళ్ళు చాలా జాగ్రత్తగా ఉండాలి.
యూజువలీ ఎవరికైతే డయాబెటీస్ ఉంటాయో చాలా మంది, ఐ ఫీల్ ఈవెన్ మై ఓన్ మామ్, she has diabetes, but she still wants to have that extra sweet after a dinner. I mean, see, I get it. People have their cravings. But one of my friends' father, he had a very minute kidney stones. So what they did was they did a simple extraction, everything done. But that simple was not simple for him because he had diabetes. It affected him more. Now he has to go through it. There are a lot of things that get attached if you're once sick with diabetes. Is there anything that you want to say to the people out there who are risking their lives with diabetes already and are risking more, basically jumping into a death hole because they're not taking care of it? Can you please say something to the viewers?
It's a very, very important message, Andy. Actually, like you said, compliance is very, very important, especially అందుకే నేను డయాబెటీస్ ఈజ్ ఈక్వలెంట్ టు హార్ట్ అటాక్ అని ఎందుకన్నా అంటే, ఇట్స్ మల్టీ ఆర్గన్, అంటే అన్ని ఆర్గన్ ఎఫెక్ట్ చేస్తుంది డయాబెటీస్. సో ఇఫ్ యూ డోంట్ టేక్ కేర్ ఆఫ్ ఇట్ ప్రాపర్లీ, స్టార్టింగ్ విత్ ఐస్, యూ కెన్ బికమ్ బ్లైండ్. Then it can go to your legs. You lose your limbs, and it will affect your limbs. And then of course, small vessel disease, large vessel disease. Then you may end up with stroke, and you may end up with heart attack. I see a lot of old people also because I rotate with nursing homes. sometimes it's very sad to see them with wounds, kind of very hard to take care of the bed sores, you know, with infections. So I think, I mean, like diabetes, it's not just obesity related. It's also familial, right? Somebody who is very fit can be type 1 diabetes because of its genetic composition. So on the kind it's better to start screening early and take care of it, because ఇప్పుడు డయాబెటీస్ హైపర్ టెన్షన్ ఉన్న వాళ్ళు నార్మల్గానే ఉంటారు, మేము ఫైన్ మాకే బ్లడ్ టెస్ట్ అంటారు. But suddenly, the blood pressure may go up to 200 and they may have bleeding in the brain and stroke, right? So then, it's all damage has already happened. Same thing with sugar. Suddenly the sugar may go up to 400 to 600 and then they may come drowsy and pass out while driving and get into accident, or, ketosis and, sepsis, and even they may have heart attack or, stroke. So the message is like, and unless you look into it, you don't know, because you look like normal people. So that's where the prevention is very important, especially in our country. Because, you have to test it, and especially people who have family history, they have to even test it very sooner. Like, like you said, your mom has diabetes. I think it's very important that you get your screening, cholesterol, sugar, hemoglobin A1C, and
Yes.
blood pressure. So that's a message we need to, I mean, like, it's not to scare them, but
Yeah, of
you have
course.
to, you
Prevention
have
is
to,
better than cure,
yeah,
of course.
no, no
Recently,
problem.
I've read it somewhere, Damodar Garu, where there was just experiment that was being conducted. It's been conducted by one of the doctors, where they said that there was a lady. There were two ladies. There was one lady, Exhibit A. She was a little obese. Let's say she was just 5 or 10 kgs over her weight, but she tremendously worked out every single day. That means she had a proper exercise every day for at least 20 to 30 minutes. Then there was this other woman, Exhibit B, who was skinny, led, was never overweight, but she never worked out. And apparently, the woman who didn't work out at all died 10 years younger than this woman who worked out tremendously. So, what is the message that you want to say to the people out there? I'm nowhere
Right,
supporting
right.
saying that you can be obese and if you work out, you live longer. I'm
No,
not
no.
saying that. But exercise does play a very important role. So, what do you think as an internal medicine, as a doctor yourself, how important is medicine and having a good, healthy life very important to lead a long life?
Very, very, very important point, because, see, basically, we cannot choose our genes, currently. Like we cannot choose our mom, dad. It's all like you're born and you have the genes. That's it. You have to live with it. So, like you said, diabetes can happen to very slim fit people because of the familial. And some people, even though they eat healthy, and their tendency towards little overweight is always there. Okay. So, but exercise, you brought up a good point. Exercise అనేది ఒక షుగర్ ను, బ్లడ్ ప్రెషర్ ను కంట్రోల్ చేసే కాదు. Exercise will help you in numerous ways. Numerous. Like, you will feel better. Your mood will be better. Your, like, hormones will get better. Your stress level will go down. Your bones will be stronger. And like you said, longevity, perfect. So exercise is like it's like a total, like diabetes affects the total organ systems. Exercise can target the total function of the body. So I would, any day, somebody exercising, like, you have a dog, let's say. There is a study, I like to look into all these old people who live 100 years. So I asked them the extra question, okay, ma'am, what do you eat? What do you drink? So they always come up, nobody smokes, nobody drinks. I mean, like social drinking. But they have active life, they have dog. Most of them have dogs, so they take care and they walk. So I would definitely encourage people to have some kind of activity which makes them happy. Like some people like dogs, so you are active, you can take them out. Some people like swimming. Perfect. That's the best exercise. So I think everybody has to at least do a. Nowadays, the trend is like 10,000 steps, and if you can make it, that's the best thing. Now you have technology like iWatch, so you can count your steps and all.
Of course.
So make use of the technology. And then again, like I said, it's all the genes. There is some, like you said, there is so much phobia after this COVID. People dying, suddenly. You see the celebrities like Puneet, Rajkumar died. He was like, doing gymnastics and, doing stunts by himself, but he ended up dying suddenly. That's genes, you cannot change your genes, but you can take care of some of the stuff. Like you said, somebody has disease, you take treatment, so you won't die. Like let somebody say, say, hey, I'm fine, I don't have any blood pressure or any symptoms. But when you check the blood pressure, it may be like 180 by 100. Then you take a tablet, then you live like other people. If you don't check it and if you don't take medication, one day you end up in the bed with paralysis, right? So that's why I think even if you have, let's say disease, so make use of it. Sugar, there's a lot of research, a lot of medication. So if you take proper medication and comply with medication, then you're fine. You know what I mean? Sometimes you
Yes.
cannot avoid these diseases, but you can control them.
Of course, like we Indians, our food habits are very different generally compared to, the American diets or even any other diets. Our diets have a lot of carbs because we eat a lot of rice. We
Mhm.
and it also consists a lot of fats, which means we have a lot of ghee. We want to have, even though we have certain amount of proteins coming in, there is still certain amounts of unnecessary unsaturated fats that happen to be. So, see, of course, we Indians, we don't want to cut down everything and be like, oh, we want to shift to salads, so we'll shift off to salad. That's completely baseless. That's not going to happen. It's going to happen only for a week. But in what Indian foods or what Indian diets or like what food methods that you want to suggest to people for a healthy life? In what way can they have this balanced diet? Include all the important nutrients in themselves. Anything that you want to say about it?
I think you have to balance it. Like, I would definitely, encourage people to, at least do 5 colorful plant-based things daily. Like, let's say in India, banana is there, and you can, eat strawberry and stuff like that. And I mean, like, weekly once you can have meat products and encourage more fish products like especially the salmon, which has very high omega 3 fatty acids, and also of course chicken lean meat is better a couple of times a week, and of course the lentils is better, and vegetables obviously very important, so you got to add your vegetables to even to your meat products. And also I think calorie count is one of the important thing, like like they say eat like a you know king at breakfast, and slowly lunch a little less, and dinner even lesser, so that way you can put a count on calorie. But all these, I mean, like, Indian food actually is really coming back, and because a lot of stuff helps, like ginger, garlic, especially the turmeric. Even people are taking tablets now because it helps to prevent the cancer. So, and immunity, you see after COVID came, a lot of our Indian, things have become very popular because cinnamon, it builds up immunity. So a lot of people are adding cinnamon powder now. So Indian food is actually the best food in my opinion. But again, like oil. Oil is very important. You got to know what kind of oil to use. Basically, so most of the oil, can lead to cholesterol problems. So use the proper oil. Especially the one, the good thing is olive oil is really good. It's proven it helps. Other vegetables oils or their avocado oil is also come up now. It's a really good fat. There are fats like ghee. You say ghee actually is compact. It's they say it's reasonable quantity. It's good. So like our food, it's really good, but you got to do it in a balanced way. Our food is the best, but you got to, especially nowadays people are eating sprouts and all. It's very good. So so we have to just balance it, and I think and then exercise and sleep better. Sleep is important part also. We didn't discuss sleep, but sleep is very important. Like at least 6 to 8 hours of sleep is very important to have a good mood, and so you can work better.
And also, doctor, what a lot of Indians we do here. I mean, in India, pharmacies work very different. You do not have to actually have a doctor's prescription to get medicines here. Or, as long as you got like, oh, give me one sheet of Dolo and they'll take it. So this annoying habit of a lot of people is that they will eat medicines as if they're chocolates just because they're having like the most minute thing in their body. Let's say people are having cold, so there is something called as over-the-counter medicines, but then people don't really understand the adverse effects they can have if they keep taking it again and again and again. So if you have to say something to say to all of these kind of people watching the show right now, whoever is taking this unprescribed medicines all the time, what is it, and can you also explain the harmful adverse effects that can cause to them in future?
Very, very important thing, Andy, because like I said, any tablet, any medicine, if you can avoid, that's the best thing. You know what I mean? You don't want to put something artificial into your body if you don't need to. And so, every medicine has a risk. Even Tylenol, paracetamol, it comes with its own risk. So, I mean, like, if you are taking for right reason, that's fine. Gallo Baram laga, it may work, but sometimes it may end up with a side effect. ఇప్పుడు బాగానే కంట్రోల్ చేశారు, కంట్రోల్ సబ్స్టాన్సెస్ కంట్రోల్ చేశారు, ఎస్పెషల్లీ స్లీపింగ్ పిల్స్, తర్వాత నార్కోటిక్ మెడికేషన్స్ ఇప్పుడు అంత ఈజీగా దొరికాయి ఇండియాలో కూడా. ఓవర్ ద కౌంటర్ ఇక్కడ కూడా అమెరికాలో కూడా ఉన్నాయి ఓవర్ ద కౌంటర్. బట్ ఆ ఓవర్ ద కౌంటర్ కూడా ఐ థింక్ కొంచెం ప్రాపర్ గా ఇన్స్ట్రక్షన్స్ చదివి you have to know exactly how much you have to take, and how frequently you have to take. అది కొంచెం కేర్ఫుల్ ఉండాలి. ఇక్కడ కూడా యూజ్ చేస్తారు ఓవర్ ద కౌంటర్. But let's say somebody is having frequent infection, sinus infection, cough, cold. There could be something brewing there. You know what I mean? And if you go temporary relief, పోయి డీకంజెస్టెంట్ తెచ్చుకుంటావు, అయిపోతుంది, మళ్ళీ వస్తుంది. సో అది ఇంకా నీకు లోపల అది బాడీస్ అయినాక అప్పుడు డాక్టర్ దగ్గరికి పోతే ప్రయోజనం ఉండదు కదా. సో అందుకనే కొంచెము ఇంటెలిజెంట్ గా there is a lot of information on the internet. I'm sure a lot of people are using internet to learn, and it's useful, but make good use of it. And another, like there is information, but like there is good virus, bad virus, like so so you have to utilize it for your betterment.
Can you suggest, viewers watching the show, what kind of preventing tests that they can take, or they can ask their general doctor to be like, okay, listen, I have crossed 30, let's say someone crossed 30 years old. What kind of tests must they be doing? How can they monitor it themselves? Anything that you can say to the viewers?
That's where actually America is doing much better in preventive care. So basically, if somebody, let's say you said 30, I think the best thing would be at least to get a screening blood pressure checkup, and fasting lipid profile, and a thyroid TSH level, and also a fasting blood sugar, and hemoglobin A1C అనే ఉంది. అది కూడా it helps to know like how your sugar has been for at least 6 months. సో అది ఒకటి. ఇవి బేసిక్ ఇవి చేసుకుంటే సరిపోతుందండి బేసికలీ ఆ ఏజ్ లో. తర్వాత సంబడి క్రాసింగ్ 40-45 వచ్చేసరికి డెఫినెట్లీ కొలనోస్కోపీ చేయించుకోవాలండి. ఎందుకంటే కోలన్ క్యాన్సర్ ఇంకా ఫ్యామిలీ హిస్టరీ ఉన్న వాళ్ళకైతే ఇంకా ముందే చేయించుకోవాల్సి ఉంటుంది కోలన్ క్యాన్సర్ ఉన్న వాళ్ళకి. తర్వాత ఇంకా ఇట్లా 50కి వచ్చిన తర్వాత ప్రాస్టేట్ పిఎస్ఏ స్క్రీనింగ్ చేసుకోవాల్సి ఉంటుంది. ఎస్పెషల్లీ ఉమెన్ కి ఆఫ్ కోర్స్ mammogram and pap smear is very important to prevent breast cancer and cervical cancer. And when you grow older, I guess pneumo vaccine తీసుకోవాలి, pneumonia vaccine, తర్వాత shingle vaccine తీసుకోవాలి after 50, because zoster pain will be really horrible. So all these, any doctor can guide you and get all the screening tests, depending on age prakaram. Important అండి. పిల్లలకి కూడా పిల్లలకి కూడా వ్యాక్సిన్స్ చాలా ఇంపార్టెంట్. ఏ ఏజ్ లో ఏ వ్యాక్సిన్ ఇవ్వాలి. ఇప్పుడు లాట్ ఆఫ్ టైమ్ సర్వైకల్ క్యాన్సర్ ఉంది కదండి, ఇట్ ఈస్ ప్రివెంటబుల్. సర్వైకల్ క్యాన్సర్ ఇఫ్ దే టేక్ హెచ్పివి ప్రివెన్షన్ అండ్ వ్యాక్సిన్స్ ఎట్ adolescent age. So I think ఇవన్నీ if you go to any doctor, I think they will get all the information. It's very important to start this process from childhood itself.
Okay, Dr. Garu, thank you so much. You tuned in and you gave your valuable time to us and the viewers watching the show. So I'm sure they've enjoyed the show. I have completely enjoyed the show. You did give a lot of information.
Thank you, Andy, and it's a pleasure. And Ganapati Papa Moria.
Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.